So I'm delighted that all of you are here, and clearly you are all happy to be here, and you're happy to be connecting with others who are here, and that's what we're all about here at the university and here in the college. So I want to say good morning, and I want to thank you again for joining us today for what for I think all of us is a very special occasion. I'm Sue Curry. I'm the Dean of the College of Public Health, and it is my great pleasure to welcome all of you here today for one of the most important annual events in our college, and that's the presentation of the Richard and Barbara Hansen Leadership Award and Distinguished Lecture. This award, as many of you know, is the highest honor conferred by the College of Public Health. And each year in the fall semester, we come together as a community to recognize and celebrate an outstanding leader in the field of public health. And we do this for a number of reasons. First, of course, is to honor someone who has demonstrated truly exemplary leadership and dedicated service to improve the health and well-being of others, and not just the health of individuals, but of entire communities and populations of people. Secondly, this event is an opportunity for us to be challenged, enlightened, and inspired by remarkable leaders. This is fundamental to the educational experience we uphold in the College of Public Health. We want Iowa students, faculty, and staff, and the broader community we are part of to have the opportunity to hear from and interact with groundbreaking leaders in public health, to listen to their ideas, talk with them about their life experiences, and benefit from their wisdom. We are fortunate to have this unique opportunity to celebrate and to be inspired because of the generosity, leadership, and vision of two very special friends who are with us today, Richard and Barbara Hansen of Iowa City. And they hate when I do this, but there they are. In 2000, Dick and Barb endowed the award that we present today. They were the very first founding partners of this college, and we are grateful for your continuing support and friendship. So thank you, Dick and Barb, and we're going to applaud you again. Now, it is my honor and privilege to introduce the 2015 Hansen Leadership Award recipient, Byllye Avery. For more than 40 years, Byllye has been on the front lines of the women's health movement in the United States, leading advocacy, educational, and self-help initiatives that explore how race, gender, and class affect women's health and empowerment. She is the founder of the Black Women's Health Imperative and co-founder of Raising Women's Voices for the Healthcare We Need. Through her work with these organizations and other initiatives, she continues to document and speak on Black women's health experiences in America, highlighting the effects of factors such as poverty, crime, violence, and racism. Prior to her entry into the health arena, Byllye taught special education to emotionally disturbed students and consulted on learning disabilities in public schools and universities throughout the southeastern United States. She studied psychology at Talladega College and earned a master's in special education from the University of Florida. Byllye's commitment to women's health began in the mid-1970s when she co-founded both the Gainesville, Florida Women's Health Center and a midwifery birthing center known today as the Birth and Wellness Center. This work laid the foundation for further grassroots advocacy efforts focused on issues related to women's wellness, sexuality, and reproduction. Throughout her career, a special focus of her work in women's health has been to confront and overcome what she calls the conspiracy of silence, the tendency she saw among many women not to talk about their health, share their experiences, and help one another cope with the health challenges they faced. Byllye's leadership and advocacy has been widely recognized in many honors and awards, including in 1989, a MacArthur Foundation Fellowship, also known as the Genius Grant. In addition, she received the Institute of Medicine's Gustav Leinhardt Award for Advancement of Healthcare. Byllye has served on the Charter Advisory Committee for the Office of Research on Women's Health of the National Institutes of Health and has served as a visiting fellow at the Harvard School of Public Health. She holds honorary degrees from many institutions, including Thomas Jefferson University, State University of New York at Binghamton, Gettysburg College, and Bowdoin College. So we are deeply honored today to recognize the 2015 Richard and Barbara Hansen Leadership Award recipient, Byllye Avery, who will speak on why Black women's health matters. So before you start your remarks, we acknowledge this with a lovely 400-pound
Thank you for that wonderful, wonderful introduction. Good morning, everybody.
Good morning.
Oh, wow, y'all are with it. How you doing? Good? 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 All right. I want to thank the School of Public Health for selecting me to receive this great honor. I want to thank the Hansens for making it possible. And I want to thank all of you for showing up this morning so that we can have a conversation about why Black women's health matters. And I want to say a special thank you for my sisters who are in the room. I always consider it an honor to represent where we are, who we are, and where we want to go. And it feels good this morning. So I have a few notes. I usually don't speak from notes, but I got some real important things I want to make sure I say. And one of the things that happen when you don't speak from notes, sometimes you leave things out and you say, oh, I wish I said that. So I decided I'll do part of it just talking, and then part of it I'll go to my notes. I'm quite often asked, how did I get into this work? And because, you don't really hear people say, well, when I grow up, I want to be an activist. That's just not, they want to drive a fire truck, they want to be a fireman, they want to be a policeman, they want to be teachers, but not an activist. And I think a lot of us activists sort of get the job coming out of some tragedy, something that, woke us up and said, oh my goodness, I need to do something about this. Well, that happened with me after the death of my husband, Wesley, who was 33 years old. He had a massive heart attack. We were at the University of Florida campus, and he was about 4 months away from getting his doctorate. And we were planning to go off, and I think we were planning to go to Oregon and try to live the American dream. And the 70s was a time before we found out about high blood pressure being a silent killer. And in hindsight, he had been told that his pressure was high when he was about to be inducted into the service, and they laid him down and they took it again. And eventually he got a deferment because I was threatening a miscarriage. And so we didn't think much of high blood pressure. As a matter of fact, it was such a common thing in the Black community. It was like uncommon for someone not to have it. And so shortly after his death, I realized, here we were, two educated people. And it doesn't really matter how much education you have. If you really don't know how to take care of yourself, you're basically ignorant. And why didn't we know this? Well, I was in Gainesville, which was the place of the second wave of feminism. So it was a very, very hot town during that time. And I remember Wesley, we were like the typical family, we'd go off to work and we'd come back home, and we had the two children, and I'd go in the kitchen and start cooking, and he'd either read. Most of the time he was reading all the time, or looking at TV, and I'm mad because I got to cook, and I want to be sitting down reading too, And so he would have books that he said, "Billy, you need to read this, you need to read this." And so to spite him, I wouldn't read them. Just so, I had to get back at him some way. And so he had been dead about a year or so. And I thought, there was one book he said I really needed to read, and I picked it up, and it was Betty Friedan's The Feminine Mystique. I cannot believe I missed the opportunity to have the political discussion with him between what he was reading and thought I would like to do and what he wasn't helping me do at home. We never had that discussion. But nevertheless, between his death and the rise of feminism, it struck something inside of me. And in hindsight now, I realize growing up as a child, I always saw the difference between men and women and how we were treated, and how Daddy ruled everything. He made all the decisions. If he said we couldn't do something, no matter how the rest of us felt, we couldn't do it. And I always saw that. So I came with that. So I was at the University of Florida. I was a head teacher for a unit for autistic kids. And but the thing about this unit, the chief was Paul Adams, who was a Quaker. And so he was a really visionary man, and he hated the present. So he always lived in the future. And so he drug all us in the future with him. Like we were doing things that people in California was doing, like being in the transcendental meditation and oming and learning about all this stuff. He had us all doing all that. And so one day he said to me, and to Judy Levy, who was the psychologist there, and I should mention, today is her birthday, October 8th, and she passed in 87 due to breast cancer. But she was one of the three women who we did a lot of organizing around, and I'm just having a little moment here. So he asked me and Judy if we'd do a presentation about what was happening with women's reproductive health and what was going on. Well, this is a time when folks were pushing to get Roe v. Wade. Roe v. Wade was coming up in the Supreme Court. So there was all this push, and there was all this attention being paid to women who were dying from illegal abortions. And it was really pretty frightening for those of you whose hair might be as white as mine is turning. I'm sure you remember how devastating that was. And so he asked us to talk about it. Well, I got real nervous because what would my mother say about me talking about abortion? I'd never heard that word in my house, and I know my mother didn't approve. And I was one of the good girls. I did what my mother told me because there could be consequences. and so I'm telling everybody, I don't know how I'm going to talk about this. And, I can't believe Paul asked me to do this. And so they're telling me, well, listen, you're a grown woman and you are on your job. And this is your boss. So you got to figure out how to do it. So I did. And Judy and I did this presentation. And it was just kind of theoretical, out of our heads kind of presentation, not based on any practice or any kind of real knowledge, to tell you the truth. We just were reporting on what we knew and what we heard, not thinking it would be anything going past that. Well, little did we know, we got a call from a white woman who said that she needed to get a safe abortion. We said, okay. We called up, we found out that we could call up clergy consultation, who was a group of priests, Catholic priests, who helped women get safe abortions. They were based up in the Judson Church in New York City. I know you can't believe that's true, but it is. You can check me out. You can look, and there are people in the room who know it was true. And so they gave us a telephone number that we would give to the woman. We gave to the woman so she could go to New York and go to the women's center at that time. It's an abortion clinic. So that happened. A few weeks later, black woman came and asked us, and okay, we got this. We tried to give her the number. She said, I don't need no number. I don't know nobody in New York. I don't have no money to get to New York. And we were of no help to her. And then about a month or so later, 6 weeks or so, she died from a self-induced abortion. And I don't know, that whole thing galvanized me, Judy Levy, and Margaret Parrish. And I get kind of sad because both of them are gone now. They are no longer here, but they were very, very brave women. And in 1974, we opened up the Gainesville Women's Health Center. But we were real clear. We were not just about abortion, that we were about women's health, which means we looked at birth, we looked at menstruation, we looked at menopause, because all of those things are all tied up inside of us. And we were not going to be a one-dimensional kind of facility. So we did the Gainesville Women's Health Center, and it was there that I learned that I'm not going to go into all of that right now, but one of the main lessons that came out of that for me is that while we had African American women coming in for crisis services, like the abortions, we were not getting them back to come in for the well woman care. Our well woman clients were students from the university who didn't want anybody to know their business. So they came to us. And so my push was, how do I get black women to come in for well woman care? Well, while we were there, all sorts of incredible things happened. And one thing that happened that became very significant for us is that white women started questioning birth and started talking about how birth was not, was not the humanistic experience that they wanted. And they wanted involvement, wanted to know more about their bodies, wanted to know more of what was going on. So they started having their babies at home. And don't you know this upset the OB-GYNs worse than anything in the world? Because that's their major population. They were having their babies at home. And they would bring their babies because it was illegal. There was only one or two physicians that would see the babies. It happened. So we did have a pediatrician who would see the babies. But if the women need OB-GYN care, they came to us. And the doctors who performed our abortions were residents, OB-GYN residents. And they were real glad to have another whole population, to learn their crafts. And so it was so many of these women. And so we sort of said, okay, maybe we need a birthing center. And so one night in Gainesville, we called a meeting, and we were just at a regular 2-bedroom house. We had like over 100 people showed up to the meeting. So we knew that there was interest in a birthing center. And in 1978, we opened up Birthplace, which was a birthing center, midwife, one baby, head first. And we created incredible services. We created services the way we wanted to be treated, which is what we did also at the abortion clinic. We thought, how do you want to be treated when you go in? And we put in all kinds of things. I call it exquisite services with the midwife. And we did things unheard of. Like, we invited the fathers to come on the visits. Come on the first visit, come on all the visits. They were welcome. We invited the fathers to be a part of the birthing scene. We had two birthing suites. One had a wonderful big brass bed in it. The other one had a four-poster mahogany bed in it. They all had full-length mirrors so that women could watch the birth of their child if they wanted it. And it was just incredible, an incredible experience. And we started with the women, since we are not sick when we're pregnant. And it's one of the times when we'll go to the doctor more than we'll go, except we have a major chronic disease. We use that time to help the family grow, to get ready for the birth of a child. Because if anybody in here has ever had a baby, they change everything when they arrive. They change everything. And so, and at the time of the birth, the whole families would move into this big house. We had a kitchen, we had everything. And it was sort of like having a home birth. And the whole families would come in. The daddies, after the head was born, they caught the babies, they cut the cord, they gave the babies their first bath, and not a one of them fainted. Not yet. We never lost a one, not one. They were able to handle it. But I also noticed something there about the black women and men who came. And I remember sometimes you can give out too much health information. And I remember this one couple, they kept saying, they didn't seem like they were fitting into this mold that we had made, that all the white women were all flowing into and just embracing. And we had some black women who did, but this particular couple, I remember, and her name was Maisha, she said to me, "You know what, Billy, y'all make us feel like I have to have a medical degree just to have a baby. I just want to have my baby. I don't need to know all that information you all giving me about this and about that." And she said, "And it's scaring us to death." So sometimes in our zest, we can overdo it. And so we had to pull back and figure out what was the information. We didn't have very many black women coming to our facility because you had to pay cash money, because the insurance companies only gave a midwife $200 at that time for a birth. And we were charging $1,300, which was much less than the $4,000 that the insurance companies were paying to the hospital. So the birthing center has undergone several name changes, but it still exists. And the last time I was in Gainesville, the work that they were doing that was incredible is that they were seeing Medicaid patients. And they found out that they broke that mold that said they don't come back for their follow-ups. That was not it. That was not the case. Because what they maintained was that loving and caring. Pregnant women need a lot of love, need a lot of caring. And I remember one woman said to me, "I was so excited this morning because it was my day to come to birthplace." That's the way you need health facilities to be, that you feel excited when you go in there, and not to even speak of the fact that they could bring their kids, because we had a child care room, we had a playground outside, and it was just a family event, which is the way it needs to be. I left the birthing center and I started working at community college. The reason I left is because we really need more midwives, and they didn't need more talking types, like me. They really, anyway. So I went to, but while there, I actually witnessed about 100 births. And I just want to say this one thing before I move off births. One of the things that was so important, and I want you to keep this in your mind, is that we have intuition. Not only us women, but men have it too. And sometimes we don't tap into our intuition. But I saw it work in so many ways. I can remember one day I was at my desk downstairs and I jumped up and I ran upstairs and I was in the birthing room checking everything, putting everything in place. And Nancy, the midwife, came. She said, "Oh, my goodness, you're nesting. I guess we're going to have a baby." And sure enough, we did. Then I remember another time we were in the middle of a birth and something was not right because I had only seen normal birth. And I didn't know what was wrong. But I found myself standing in front of Nancy, handing her a Gelpy retractor. Now, I don't even still can't remember. Somebody has told me, as I've told this story before, exactly what it does. And she said, that's exactly what I need. Where did that come from? And then the last story is that a woman was in labor, and I think she probably was like at 6 centimeters. And Nancy said, Bill, I'm going to go over in the next room and take a nap. And I'm like, oh, no, don't leave me. She says, I'm just in the next room. If you just call my name, I'll hear you. She took a quick nap, and she came back, and she said, oh, I had a dream. We had a baby with no neck. And I'm saying, oh, my goodness. She said, no, it's not that. She says, it's something that I'm supposed to do about the neck. And when that baby was born, the cord was around the neck. She reached over, pulled the cord over the baby's head, and all. Now, I don't know what happened when you're in big places with concrete walls and all that, and when you're not supposed to think about that level of intuition. But it's the same thing that works that we tell in teaching people about rape prevention. It's your first mind. And if you are about to go out on a date with somebody and your first mind tells you not to, obey it. Sort of like the same kind of thing. So I left there and I started working at Santa Fe Community College. I'm getting to the Black women's health, y'all. I started working at Santa Fe Community College was a CETA program. That was a comprehensive education training act that pulled together young people that had been pushed out of school so that they could finish their education. And it was overwhelmingly young Black women. I mean, really young, 19, 20, 21. And I noticed that so many of them was missing school, and they were getting paid minimum wage to come to school. And I thought, what a delight this is. Nobody ever paid me to go to school, and so why weren't they coming to school? I couldn't understand it. Then as I started to talk to them, I found out about the health issues that they were dealing with as young women. Diabetes, several of them were hypertensive, real problem, lupus, you name the gamut. And they were using up their time for sick leave, and some of them had too many children already. One woman was 19 and she had about 3 or 4 children. And I'm saying to her, how can you have that many children and you only you're not even 20 years old? And when did it start? She said, I got pregnant when I was 13 and I was taking care of my mother's children. And we always talk about what was your mother's life like. And I decided I could have me some children of my own and get my own apartment. And I'm saying, but there's another way to leave home. You don't have to go have a baby or 2 in order to be. But people make the best decisions that they can make at the time they make them. Most of them a lack of information. So I started thinking about, well, now I've been doing all this women's health work, and I've been working primarily with white women. And what is the difference between Black women's health issues and white women's health issues? And why weren't we focusing all on the same things? And I remember it was 1979, and Health United States 1979 came out, and I was looking in there at the health statistics, and that's when I discovered our health issues. And one that really disturbed me, they said over half of the Black women they talked about rated themselves as living in psychological distress, and they rated that distress greater than white women who were diagnosed mental patients. I was so angry, I threw the book across the room that this kind of thing was happening, and it was in a book somewhere in a shelf at HHS, and people didn't, HEW it was that time, people didn't know about it. And I sat down and started to write my first grant. Never written a grant before, but I was on the board of the National Women's Health Network, which helped us a lot. And really, we were a program of the network. And about a year, I think at the next network meeting, I said to Norma Swenson, who was one of the women who wrote Our Bodies, Ourselves, I said, I'm thinking about doing a project on Black women's health. What do you think? And she said, oh, I think it would be absolutely incredible and that you should do it. And I remember I needed more validation, so I wrote to Dr. June Jackson Christmas, who was the president of APHA, and asked her what does she think about it. And you know what? She wrote me back. I couldn't believe I got a letter back from her saying, yes, do it, do it, do it. So, you never know who you're going to get a letter from. And when you're sitting in powerful positions, you need to answer those letters. Because what if she hadn't answered me when I needed some validation? So then I started to work on organizing this conference, which was held in 1983 at Spelman College. I thought we'd have 200 to 300 women come. We had close to 2,000. And the way it all happened, I consider it magic. That I was in the right place at the right time. I moved from Gainesville to Atlanta and organized the committee that met for 2 years to organize the conference, and I didn't know people. So what I did know how to do was to use the people I knew to help me get to other people. So when the white women at the network would say, what can I do to help you? I said, do you know any Black women where you live? Send me their names. And that's how we got people from all over the country. We came together. Fannie Lou Hamer's words were our words. We're sick and tired of being sick and tired. And because we put the word Black in front of women's health, Black women came. And so we met for 3 days. It was just an incredible, incredible event. People were all happy to be there. And I remember one workshop we had called Black and Female, What is the Reality? And the workshop was so big that we had to move it into the hallway. We didn't have a room on Spelman's campus big enough for it. And women broke the silence. And we started talking about the realities of our lives. And we started to understand the psychological distress. So we formed self-help groups that help us talk about being victims of domestic violence, being victims of sexual abuse. And this was before Oprah and all of them started talking about it on the TV in the afternoon, that these brave women talked about psychological abuse. And then you understand, if you're living in this kind of household, if you're living in this kind of environment, this is not a personal problem. This is an institution of sexism problem that needs to be dealt with. It's not Byllye's business. It's not anybody else's business. This is something that needs to be stopped. And how can you think about getting a pap smear or getting a mammogram when you're living with this? And what we also learned, it just wasn't happening to us. Like, I lived in a family where my dad beat my mother. My mother was a teacher. My dad ran a cafe, and then he ran a juke joint. But he was Lord and Master of our house, and I saw him beat her twice. But I thought that just was happening to me. But when you sit in a circle with 25, 30 women, and you find out that a fifth to a half of them have also had this, then it's not Byllye's problem any longer. Something that must be dealt with. So some of us have had and are still living really hard lives. And what we started to break that conspiracy of silence by talking out loud about it. And one of the things we taught women is that you were born warm, zestful, loving, creative human beings. And you were not put here on earth to be messed with by anybody. And you don't have to take it. You don't have to take it. And we had to help them start the unhooking process because they couldn't extricate themselves just by hearing this. People had to grow inside and become empowered and figure out a plan and teach women what you mean. I said to one of our friends who was in a violent situation, I said, you got to make a plan. And she says, what do you mean? You know, they don't understand. You got to make a plan. You can't just decide you're going to walk out and walk out the next day. Because if you don't have a plan to take it all the way through the end, you know, you end up going back in that abusive situation. We had to work out what to do about sexual abuse. And I had to say to women, if you're living with a man that's messing with your daughter, get over being alone because you ain't with nothing in the first place. You understand? And we had to do that. We had to help mothers learn how to protect their daughters and get the daughters from being angry with their mothers because they didn't protect them. The mothers couldn't protect themselves. And so they would tell them, just put up with it until you get old enough to leave home, which is often what their mothers told them. So intergenerational health is crucial around a lot of things. Sex information, how that is shared is so important. I remember when I got my period, my mother said, it's here. And you going to college? No, if you get pregnant, I'll kill you. You're going to Talladega College, and that was all the information I got. And I told you I was a good girl. I followed the rules, and it worked for me. But when I had my little daughter, I knew I was going to have to do something different for her because I wasn't the kind of mother that my mother was, and that she wasn't the daughter that I was. So we had to give out different information. What we have to realize is that a lot of the reasons the mothers don't give the information, the mothers don't have the information because we don't have a whole legacy of passing down this information. It's not no one talk. It's talking all the time, all through the whole years, and being open. Like I said, I tell my children, I'm a mother, you can tell me anything, no matter what. I don't care how bad it is, you can tell me. Now they'll come and tell me, and I might have to go and give me a moment. Let me go in the room, have a fit, scream, but I have to come back out and listen, and you want to be the mother that your children can come and tell you anything, no matter what, which means you have to do a lot of work along that line. So now I'm going to go to my notes. And we can talk more about that during Q&A if you want to, because I have still a lot more to say about it, because I think sometimes we're told to do things, but we don't know how to do them. And we want to do them, and we don't want to let people know we don't know how. But especially around sex information, a lot of us don't come from families where we talk about it. We don't talk about it at all. Another thing we don't talk about is money, how to manage money. We definitely don't talk about that. And then that kills us. That kills us. That makes us live from paycheck to paycheck if we are lucky. If we are lucky. And that's a silence that needs to be broken too. Now, the current state of black women in the United States, in terms of working, the unemployment rate is down to 5.5%, but it's about 8.9, almost 9% for black women. So a lot of us are not working. You need to be working. While in the national average, 1 in 7 women live in poverty, we have 1 in 4 black women living in poverty. And this includes women who have extended family members and dependents, and also the rate of incarceration also plays into this number. So we have to look at all these intersections that impact on the lives of black women. Even when we got a little quarters to rub together and we go and try to buy a house, the subprime mortgages hit us really hard, and much more than anybody else. And that was devastating. A lot of women had homes, and they lost their homes. I know of many of them who did it. It starts early with the whole feeling is that we are not good enough, that we're not quite up to par. That whole information starts early with us. And with school suspensions, black girls are suspended 6 times more than white girls for the same behavior. Black women in higher level incomes were 5 times more likely to receive high cost mortgages. So, things just really get us. Black girls are the fastest growing population of juveniles in the prison system. The fastest growing population. And 1 in every 118 white women will be in prison. For black women, the rate is 1 in 18. And I can't believe that we are any worse than white women. We're not. We are in prison more. There are a lot of issues that affect us. One of the main ones is income inequality. You can't get away from capitalism when we live in a capitalistic society. A lot of that is because we are not taught how to handle money. And you say we don't have any money. Well, we do have a little money. We haven't been taught how to handle that little bit of money that we have. We get bought in, we got to have this, we got to have this, we got to pay for this, we got to have things that you see people have. You don't know how they got those things, But we have to learn how to talk about money in our families. We did not talk about money in our families. And whenever we ran into any problems, what did my mom and them do? They went to household finance. Household finance has been made wealthy off of black folks. I want to tell you, go take a loan out to take care of this. You pay that down, then you get another loan. My mother, when she died at 104, one of the bills that we paid off was household finance. Household finance was in our family for my whole lifetime. And I know some of y'all out there the same way. You have to be, because that's the way they made it. Go and get another loan. And how much money did she pay into HFC? Just a lot. Another issue, police brutality. We all know about that. I don't need to talk about that. Criminal justice, racial profiling, domestic violence. I'm telling you, domestic violence is awful. I lived in a family where my dad beat my mother. He pulled a gun on her, and it is awful on your head. And I worried that I would not be able to go to college. Why am I telling you this? Because you got to own up to these things. You got to be able, if you can't sit and talk with them out loud in the presence of others, you at least be able to sit and talk with them out loud at home and come to realize that this is a cycle that has to be broken, that next generation does not carry that alone, that we were all born warm, zestful, loving, creative human beings, and we were not put here on earth to be messed with by anybody, and we don't have to take it. And we have to teach that to our girls, and we have to teach that to our boys. We have to be active in teaching that. Reproductive justice. A lot of us grew up in homes where we didn't talk about it. We didn't talk about sex. We didn't talk about menstruation. We didn't talk about anything. Everybody had to fend and figure out how to learn it for yourself. I got my period. My mother said, it's here. And that was that was all I got. But when my daughter came along, I looked at her and I thought, that is not going to work for her. We got to give out some more information here. You see? And you got to be proactive, and you got to be the parents who your child can come and tell you anything, no matter what. You got to do that. And when they come and tell you, it's going to freak you out. You go in the other room and get yourself together and come back. You have to do that. You have to be open, and we have to teach that to them. Let them know that the pipeline is open. And you need to keep that communication going on. Another issue is housing. I don't need to say more about that. You understand that. Quality education. People need to get involved with the education of your kids. And you can say, well, I got so many things that I'm dealing with already. You do. And you got another thing you need to deal with. And if you're not ready to do that, don't have the baby now. This is not the time. Because that next person needs to be able to move forward, needs to move on. And then, of course, we need access to quality health care. And here you have Medicaid expansion, so I don't even need to go into my Medicaid expansion talk. And all of you are here, and all of you know the importance of health care and what we need to pass on to the next generation. A lot of health issues that's facing us, many of them, breast cancer, cervical cancer, HIV/AIDS, diabetes, heart disease, reproductive justice, and obesity. And due to a lot of these conditions, our babies are dying, our mothers are dying, women are dying. We live in a toxic environment and really understand that maternal mortality is a problem. And everybody talks about infant mortality, but Black mothers are dying because a lot of these pre-existing conditions that cause it. I know y'all school of public health, I'm preaching to the choir, but sometimes we forget to say these things out loud, and we need to be reminded of them. Another thing, why I chose the title about Black women's health matters, a lot due to the killing of young Black people in our neighborhoods. And you know, as Black mothers, we worry about our children until they get a certain age. And then you think, I can take a little rest. So I worried about my son until he got like in his late 20s, kind of hit 30. I figured, okay, so he's kind of out of the range. Then we go have a grandson now. And we was sitting in, Gina and I was sitting in Tampa at dinner with he's mixed race. His grandfather's Cuban and white and Cuban. And we sitting in dinner with him. And I can't remember exactly how the conversation came up, but grandson and all of them, they were at the other end of the table. And I said something to him. I said, well, my goodness, I just finished worrying about Wesley, who is his father. And now I got to worry about little Wes. And he said, about what? I said about police brutality, being in the wrong place at the wrong time, and how I'm going to get him up, until he's in his late 20s so I can stop worrying. He looked at me with such a shock. And I'm telling you, I don't think white parents worry about their children being killed by police, falling into the wrong group of people, being in the wrong place at the wrong time. They don't worry about being stopped for something that seems like a minor offense and they end up being dead. This is a public health issue. And all of you need to understand what we as Black parents and other parents of color go through as we try to rear our children. It is frightening. We feel like they're in a very toxic environment. A kid who is wonderful, who is incredible, who is great, can be misunderstood in a second. In a second. And I could tell that Dan, his grandfather, we only has one, he had never thought about this. He had never thought about this. And he loves this kid like you wouldn't believe. But that's the only way that you get the reality of what it's like to raise a Black child. It's an everyday reality for a lot of people. So I was at this meeting with reproductive justice. How am I doing on my time? Am I all right? 10 minutes? Okay. I was at this meeting of reproductive justice advocates 2 weekends ago. So I told them that I was coming here. And I was going to be talking about why Black women's health matters. So I asked them if they would just write down for me what I should say to you about why Black women's health matters. I'm not going to read all of them. I'm just going to read a few. Black women's health matters because our health has the power to either propel us or destroy us. Our health impacts our family structure, socioeconomic status, and many other aspects of our identity and culture. That's why it matters to the world, because our contributions are invaluable. One person said, because I matter. Black women's health matters because of survival of our families. That we have been targeted for elimination. This is how some people feel. We have no choice but to fight back, not only to survive, but to thrive. Black women's life matters because we are the source of future generations. Black women's life matters because we carry our communities and family on our shoulders. Black women's lives matter because we are magnificent and deserve to be cared for. Did you get that? We are magnificent and deserve to be cared for. Black women's health matters because we are the leaders in our families. When we are healthy and strong, our families are healthy and strong. Black women's health matters because we are the nexus of the family. Making sure we are healthy keeps the entire family healthy. We had about 5 or 6 of them that went along that family caring line. Because Black women are magic. Black women's health matters because we are the backbone and consciousness of our communities, the body and soul of this nation. And the last one I'm going to read says, because it has not mattered for so long. How does it feel to be a generation of people who feel that your life has not mattered? And that's what Black women said to us when we founded the National Black Women's Health Project, as it was originally called, in 1983. This is the first time anybody has ever told us that our lives matter. So what are we doing? We have a new name called the Black Women's Health Imperative. They felt like projects sound temporary. I said, we're 20 some odd years old. We're not very temporary. But anyway, you have these boards that want to do things. So we're now called the Black Women's Health Imperative, and so what we're doing is speaking directly to women right where they are. And we have a long legacy of learnings. We have like 3 or 4 programs, initiatives. One is Change Your Lifestyle, Change Your Life. And this is a program that's been funded now for 8 years by CDC, in which we go into communities and train community leaders to do health work, especially around preventing diabetes. But now you all know the secret. If you work right on diabetes, you work on everything. I just say that's just the entry point. That's who's giving you the money. But you can't talk about diabetes without talking about all the other stuff, because it's all housed in one body and it all makes sense. So you just, so it doesn't matter what that title says, you're going to talk about everything. What's the reality of your life? How are you doing? What's going on with you? And so we have these programs across the country. We have another one called My Sister's Keeper, and this is for college campuses, working with young Black women, and the young boys have worked their way into it too, to look at their health in terms of reproductive health. And I think we're on about 3 campuses now, hoping to move across the HBCUs as fast as we can raise money to do it. Then we have another one called Grab Your Girls and Go, and this is about promoting optimal wellness, not only just health, but also moving past it to wellness. And it's to encourage young Black women and their girls to increase their understanding of wellness and participate in health education programs. We have another one called ACA, Access, Coverage, Action, and you can know what that is, promoting everybody to get on board with getting health insurance and understanding that. We have another one called Elevate, and that's about HIV prevention and testing. But the one I want to talk to you about is called Index Us. And this is our We just brought on a new, well, she's not new. She's been there now about a year and a couple of months. Linda Gola Blunt, who is an epidemiologist, the first public health person, the first real public health person that we've had at the helm of our organization. And she brings a lot of energy, a lot of brilliance, a lot of pizzazz. She's worked at she did work with Coca-Cola. She did work with National Cancer Society. So she's kind of like a public health refugee in here with us. You know, she's finally come home to do the work that she really wants to do. And we come up with Index Us. And what it does, and I'm going to read it to you so I can make sure I get it straight. It maps the behaviors of healthy Black women against the key changes in political, economic, and social politics by geography over time. We study healthy Black women, y'all. We're not studying the unhealthy ones. Everybody else studying the unhealthy ones. We want to learn, what do the healthy ones do, so we can promote that. It will draw upon data from the Black Women's Health Study, you know, the one that Boston University has done, where they have 59,000 Black women enrolled. And I'm telling you, I have never seen a study like this. People are so proud that they are in this study. They raise their hands. When they see me, they think it's ours. It's not really ours, it's BU. But I let them think it because I like it. And they say, I'm in the study. I'm in the study, you know, so they're proud to be there. And there are approximately 9 million healthy Black women in the U.S. We're going to document their habits and apply it to a broader population. And we want to have 12 million healthy Black women by 2020. 12 million by 2020. And it looks at a dozen factors such as family history of illness, resident and lifestyle behaviors. And anyway, that study is 20 some odd years old. We need a new one because everybody there is getting older and we got a whole slew of new people. So research ideas out there, you know, you can do that. We found that 17% of the women 40 to 49 smoked in 95 compared to 6% in 2013. It's working. It's working. If good health is defined as not having any cardiovascular disease, hypertension, disease, heart attack, stroke, or obesity, Black women fared worse. In 95, 47% of the women ages 40 to 49 met the criteria, compared to 38% in 2013. So that's not so good. So our messages are obviously not really working real well. We got to do more on that. The goal of the index include realizing that it's possible to communicate health information to women in a way that they can understand it. Instead of saying, we went out there and nobody did anything, well, that's not the women's fault, it's our fault because we didn't give it to them in a way that they could understand it, okay? So in using data science and predictive analytics, the Black Women's Health Imperative will create targeted programs, messages, and community-based solutions that private businesses will invest in. So this is the route that our new CEO has said, let's work with women where they are at their workplace because it's good for work. It's good for productivity. And they can do it while they're at work. So we're not asking them to come to a meeting at night when they're tired, when they got to cook, on the weekends, when the days they can rest and all of that, and convince the business leaders that it's in their own best interest to allow them to do it. So we're looking at Black women very differently, not defined by poverty and disease. You know, we're tired of that. So what we want to do is look at healthy Black women and see what they do. Not what we tell them to do, but what they actually do. And how do we make that happen? In a quick survey, Black women describe health and wellness as 80 to 85% says psychosocial issues, being at peace, being calm, and in control of your life. That's what they decide as health and wellness. 10% said financial, 5% said physical health, which is where we've been putting all our energy into diabetes and all of these things. And that's not what people think. That doesn't mean health to them. So if you're at APHA, and if you're going to APHA, Our CEO, Linda Blunt, will be presenting these at 10:30 on Monday. If you want to go and hear the results of the BU study. Oh, I'm sorry, I left something out. We asked BU to look at the healthy Black women in the study and see what did they say, what do they do? Not what we asked them to do, but what do they do? And then she will be presenting this result at APHA next month. Is it this month? At the end of October in Chicago. I know y'all know that. So, what to expect? 65% of the Black women describe their health as very good or excellent. So out of 59,000, that's a good sample of people to talk to. 80% of the women describe stress as their number one health factor. Number one. And then most experience racism at work or in their daily comings and going, and walking is their number one exercise. So those are the things that we expecting to find. So when I asked my CEO, what would you like for me to tell the folks in Iowa we would like from them? This is one of the leading public health schools in the nation, and one that I have a lot of faith in. Before I tell you what we want to ask for, is I can remember being in Atlanta in the 80s. I was just organizing the Black Women's Health Project, and I looked on the wall, and my doctor, she was a Black woman, and she finished from the University of Iowa Medical School. And I said, oh, well, how in the world did you get to the University of Iowa Medical School? She said, they came down to Columbus, Georgia in the housing projects and got me. So y'all seem like the right group to me. Work for me. If you have the analytics resource, it would be great to ask you all to work with us to crosswalk and analyze social media data with the Black Women's Health Study data to fully understand how Black women look at their health and what factors would motivate them to change their behavior. Sounds like a winner to me. I hope you all will take a nibble, okay? So, I'm going to skip that other part I was going to say, and I'm going to start with my closing, okay? You in public health need to stop being so nice. You all are too nice. You see the underbelly of society. You see all of the wrong things that happen. You see the country. I mean, how could we have 19 states that had an expanded Medicaid so people can get health care? How can we allow those governors to stand up and be proud that they're denying health care to their people? How can we let that happen? Y'all are too nice. We need y'all to be more like the NRA. You do, you know? The NRA can sit around and they can go in a school and shoot up hundreds of first graders and all that. Do they say anything? They keep quiet. Guns don't kill people, people kill. Well, people with guns kill people. You know what I'm saying? Y'all see the underbelly. You know the answers. You know what's right. You know what's killing us. You have them all, but y'all are too nice. We need you scholar athletes to be more active. We need you teachers to train more activists. We need public health people. I'm speaking to all you young folks I see here in the audience. You need to get on the streets and you need to act like you crazy so that people will change. They're not going to change with you being nice. It doesn't work. It doesn't work. And you know it's wrong. You know it's wrong. How can people be proud of denying health care? That's not the country I want to live in. That's not the world I want to live in. We need health care. We are at war. I'm sorry. No, but I'm not sorry. I'm not sorry. I want you to feel what I'm feeling, because I've been doing this close to 40-some years now, and the changes are not big enough, and we know how to do this. We know how to do health. We know how to do education. Look at all the country day schools. Their kids ain't dropping out. Their kids are understanding. We got the model. We have everything that we need. But I need you in public health to be more active. Make APHA be the organization that will stand up to the NRA, because all of us are behind them. That's what we need. You see the underbelly of society. You know how bad it is. And you also know the solutions, because y'all have researched everything up to yang yang. You got all of the research. Please don't study anymore. Help us with implementation and making things happen. I'm going to close with a few things that the women in the Black Women's Health Movement call Byllyeisms. And these are things for you. These are things for you. First, I need each of you to fall in love with yourself. Love yourself. Love every part of you. Because if you don't love yourself, what in the world make you think somebody else will love you? But you got to feel that self-love, because that keeps us going. Model self-care and self-love. You're rearing kids in the family and you want to teach them how to get rid of stress. You model that. One of the things I love to do is to get in and take a tub bath. Or either when you get off from work, go home, go in your bedroom, close your door and lock it, and relax, breathe. Relieve yourself. You don't have to go start cooking the minute you get home. You don't have to start doing, they can wait. You know, take care of yourself. And when they see you taking care of yourself, they will model how to take care of themselves. That's how we help future generations. It's through by what we do more than what we say, but what we do. No is a complete sentence. Complete sentence. Get the negative people out of the front row seat of your life. You do not need to have somebody telling you how bad you are. You can't do this, da-da-da-da. You don't have to hear that. Remove yourself. Remove yourself. And they're not your friends anyway. They're not anybody you want to be associated with. Get them out of the front seat of your life. Hold your head up high and strut and feel proud. I am bad. I am what's happening. I am proud, all of me, and feel that, and model that for your family, and tell people, you know, I don't need to hear all of that. Talk to the hand, as they say. All right? Take a walk every day. Walking is so good. Help you clean out the cobwebs of your mind. Help you get yourself together. Buy fresh flowers, and thank you. Buy fresh flowers for yourself. The grocery store have them now. They cost $4.99, $5.99. Most of us can afford them. You need fresh flowers because they say you are special, that you are special, and you need to feel that. Know who you belong to. Belong to yourself. And know that you were born a warm, creative, zestful, loving human being. And give yourself permission to live the life that you want. Because when you come back as a butterfly, you're going to want to be doing something different. You want to be doing something different. And in closing, I want to say, always work out of your highest self. That anybody can be down in the gutter and on the ground. But work out of your highest self. And know whether life grinds you or whether it polishes you. Depends on what you're made of. I thank you.
Thank you, Byllye. I'm speechless, and those who know me know that I'm never speechless. I know there are folks who have to get to class. We do have a few panelists who we're delighted to have with us, and I'm going to invite them up. There are also folks I know who have questions, and we will have some time for that, but I'm going to invite our panelists to come up, and I'm going to introduce them real quickly. They are each simply going to make 1 to 2 minutes of remarks, and they know that it's 1 to 2 minutes. And that should leave plenty of time for folks to participate. I also want to remind you that we have a Q&A discussion at 4 o'clock this afternoon back in this auditorium. The topic this afternoon is keeping faith, exploring connections between spirituality and health. It will be moderated by Dr. Maisha Marzell, who is an assistant professor of community and behavioral health, and there will be a reception following the discussions. So we certainly hope that we can welcome you back and that you will bring others who can be inspired by Byllye. So we have 3 wonderful panelists. The first person I'm going to introduce is Jessica Welburn, who is right there. And she is an assistant professor of sociology and African American studies. Jessica's research interests include race and ethnicity, social mobility, urban inequality, cultural sociology, and qualitative research methods. Her work has focused on the experiences of African Americans in the post-civil rights era. She's currently working on a book tentatively titled Keep On Pushin', that uses in-depth interviews and ethnographic observations to explore how working class and middle class African Americans in Detroit, Michigan navigate the city's crumbling infrastructure. We have Megan Schnorr, who I think is at the end of the table. She is the Violence Prevention Program Coordinator at the Women's Resource and Action Center. And I'm proud to say Megan earned a Master of Public Health degree from our college in 2013, and she has extensive experience in community-based intervention. She conducts trainings in bystander intervention, leads campus conversations about healthy relationships and rape culture, and engages people of all genders into preventing violence on campus. And we have Erin Foster. And Erin is a PhD student in our Department of Community and Behavioral Health. She earned her MPH in May of 2015 from our college. She graduated from Truman State University in 2013 with a BS in health science and a minor in biology. And Erin's general public health interests lie in reducing health inequities that stem from social injustices. In the future, she hopes to apply a community-based participatory research approach in low-income African American communities to improve food access. So we'll start with Jessica and just go down the row and 1 to 2 minutes. Thanks.
Hey, great. Well, this is such a wonderful talk, and I'm just so excited to have the opportunity to be here and to engage in this discussion. One of the things that really stood out to me from the talk is this idea of resilience and how Black women build resilience, the strategies that they employ to live healthy lives, and what are people doing that are right. I think far too often we focus on what minorities, African Americans, Latinos, and other groups are doing wrong. I'm a sociologist, and I admit that our discipline loves to focus on minority dysfunction. We love to document everything that's going wrong in Black communities, urban communities, suburban communities, what we avoid but admittedly frame as cultural problems. And we instead don't really talk about what people are doing to build resilience on a daily basis. And African Americans and minorities more broadly are engaged in a number of micro-level strategies on a daily basis to lead healthy lives and to lead productive lives. We're talking about people that, when we talk about African Americans and other groups, have basically always been denied the full rights of American citizenship and continue to be denied the full rights of American citizenship. And so to live in that context on a daily basis and to survive is to be resilient and is to engage in micro-level strategies that build resilience. And so I think that this talk is a wonderful call to action for all of us, researchers, activists, community members, to move beyond focusing on documenting problems, move beyond our sometimes obsession with gawking and looking at what's wrong in communities and the cultural problems that we seem to think exist, and really focus on how communities are building resilience and how they continue to exist and thrive, how minorities, how Blacks, how Black women continue to exist and thrive within very challenging circumstances, again, where we continue to be excluded from full membership in society.
Right, absolutely.
So I'll certainly echo what Jessica said and also what Byllye has said throughout her presentation. So I'm just really hopeful that we do see this shift from a deficit-based focus of research to that strength-based focus of research. While it's still important that we know what health conditions are prevalent in the Black community and things like that, we've done enough of that. We know what's prevalent. We know diabetes, obesity, and those kinds of things. And as a Black woman to consistently hear about the problems that are in the Black community, especially with Black women health, it's disheartening, it's disempowering, and it makes it seem like it's almost impossible to take control of my health. And so focusing on that strength base and looking at what Black women are doing it right and seeing like how I can improve my health by following in their example is especially important. So I just think it's really important for us to show us first so we know that it is possible to take control of our health, then also just so we can follow in those Black women's examples.
So my name is Megan. Thank you so much for having me here today. I'm in awe of your talk, and it's hard to follow and even say anything about it because it was definitely something that I needed today. It was one of those talks that fills your cup and fills you up with that energy and that activeness that you need to have moving forward. And so I took a lot of different things from your talk, but two of the main things I took away with were telling stories and intersectionality. So in sexual assault work that we're doing on campus, it's so important in the activist spaces that we work with students that they know the stories of the activists that came before them. They know the work that has been laid out over years and years, everything that people have done to lay that framework, and then where they can build on those strengths to continue to move forward. And I heard a lot of that in your talk today. And also the importance of, as white allies and as cis allies, showing up to listen to stories that folks are sharing, to do that research, to really take it upon yourself to go out there and seek out that information and to listen, and then to be active with what you've heard. Don't just sit there, don't get in that discomfort place and be like, oh, this is uncomfortable, I'm shutting down. Instead, sit in it and think about, what am I going to do with this? Where am I going to go tomorrow? And where am I going to take this information? How am I going to call others into this conversation? And then I really enjoyed the parts you were talking about intersectionality and talking about how do we think about these intersecting forms of violence that are impacting individuals. And in sexual assault prevention work, we talk about that a lot. How do we do this work from an intersectional framework? We're recognizing race, gender, sexual orientation, gender identity, and how that impacts folks. So thank you again so much. You filled me with a lot of inspiration today.
So we do have time for questions. We have two roving microphones. So if you have a question, if you want to just raise your hand and someone will bring you a mic. Everybody was left speechless. There we go.
Yes. Hi, thank you for today. I work at United Way in Cedar Rapids, and one of the questions we have as we're getting prepared for something you mentioned earlier with managed care, what are your thoughts or feedback of hopes and concerns as managed care moves into Iowa for women's health issues, minority care, continuum care?
I think one of the hardest things is to making sure everybody knows that it's going on, that they can get care, because the way the healthcare system has been set up, a lot of people are shut out and don't assume that you can tell them over the TV or over the whatever, that you got to go to extraordinary means to let people know this is for you. You know what I'm saying? Make sure that they're fully educated and to know what to expect. The other thing that is a real interesting thing is health insurance literacy. I can remember when it was time for me to sign up for Medicare. Oh my God. I don't know if y'all had to try to do that. That was so hard. And I looked at Gina, who has a DRPH, in public health, and here I've been doing all this work, and we had a hard time trying to figure out what to do. And I'm saying, if I'm having this hard time, what is happening with Miss Susie? You know what I'm saying? So health insurance literacy is real important as we move into this whole new way of buying health insurance. What are the terms? What is copay? You know, all of that we need to be taught. We've been buying car insurance, you know. We've been buying insurance on our houses. Most of us don't even know what we have until we have an accident or something like that. But you don't want to be like that with your health insurance. You need to know going in. So health insurance literacy is crucial. Now, through Raising Women's Voices, which is the other organization that I work with, we started working on when it was called healthcare reform. And we had to first educate the reproductive health community that this meant you, too, to get involved. And you can see what all is happening with all the backsliding there. So now our latest initiative is taking on healthcare reform. And if you go to our website, Raising Women's Voices for the Healthcare You Need, you will see that we just finished testing out booklets and all in several areas around making sure that it makes sense, you know, that we are defining the terms. That's one organization. It's a book with, you know, many pages and all. Black Women's Health Imperative, we're still seeking funding for the one that we want to do because our new CEO is very techie, and she wants to put it all on your iPhone so that if you're somewhere and they use a term, you can just bump and get the definition for it and all. So we want to have two approaches to it, one high tech and one low tech. The low tech one is in its final phases of being tested out. The high tech one is still to come. But teaching people about health insurance literacy, how to use the health insurance, is real important, and it's no easy task.
Services. What do you think the implications will be if Planned Parenthood becomes defunded?
It's a sad day. But from all reports, it seems as if Cecilia Richards did a real good job standing up to the inquisition she was faced with. But I don't know how that will, how that's going to play out. I think, one of the things that I find problems with, well, they provide services to like 10 million people. And what has never been, I guess, due to privacy and somehow doing the liberal thinking, that we've never used those people who have accessed Planned Parenthood for so many years. They're not politicized. You know what I'm saying? They not like the rabbit right, which if they had been seeing those people, they would have turned them into people out on the streets protesting and all of that. And that's what I mean by we are all too nice and we are in a war. And it's a shame that as long as Planned Parenthood has existed, that they don't have an army. You see what I'm saying? Because we playing by the rules, and we are respecting people's rights, and we're respecting their privacy when a lot of that's going to be gone away. I shudder to think about what will happen. Maybe shutting them down will make people then you have to take to the streets. And as Flo Kennedy said, now you men just bear with this one. Flo Kennedy said, you women got to spill more than menstrual blood to make change happen. You do. We have to get active and take to the streets. We are up against some people who, some wrong-headed thinking. And we are electing these people consistently to office. The power is in the ballot. We got to start teaching people they're not learning citizenship. People don't even understand the result of a presidential election and what that means for the Supreme Court. They don't understand the relationship between the two. You see what I'm saying? So there's some serious work to be done. And I don't know what's going to happen if Planned Parenthood is defunded, unless a bunch of us step up to the plate and demand some changes. But I think we should take to the streets.
This does work.
It helps because it's being recorded, so
Oh,
people
okay,
can
no problem.
actually take it.
Hello, my name
Hi.
is Sharday. I'm a PhD student in communication here at Iowa, and I study Black women's communication. And I'm really interested generally in taking a culturally based approach to health initiatives and recognizing that we need to be sensitive to a group's, in this case, Black women's kind of cultural idiosyncrasies. One thing I've come across in my research is oftentimes I found Black women do things that are the essence of who they are and their identity, but at the same time is incredibly unhealthy. So I wonder, just getting your perspective, how do we as researchers, activists, health practitioners, how do we help without stripping away, the very things that Black women take pride in?
Give me an example of what a behavior.
So one thing I'm studying right now in my dissertation is Black women's strength, and this idea of being a strong Black woman at all costs.
God, yeah.
But a lot of research has connected that to poor, mental health, physical health, psychological health, where they feel like they can't go and they can't talk to anyone. But there's also been research that Black women reappropriate this image as a really essence of their, pride. And again, who they
Right,
are.
but if you strip that down, what you will find out is that they're tired of that they're tired. You know what I mean? They're tired of being strong all the time. They're tired of being perceived as strong, and they're not taking care of themselves at all. That is at the basis of it, and telling people you have a right to take care of your needs and not always taking care of everybody else. If you can get folks to understand that that's not being selfish, that's being self-love, and that you're modeling for how to do it. But that's one of our biggest things. We would do everything and anything for anybody else in the world except take care of ourselves. And we wear that as a badge of courage when it's not. So it's kind of like unhooking from that and looking at what are the other factors that you have that are promoting yourself. And it's really about loving yourself and understand, why don't you love you? What is the first thing that comes into your mind when I say you need to love yourself? You see? And people just, people don't know. What do you adore about yourself? Well, I don't adore anything about myself. I only adore Jesus Christ. Well, you need to adore you. What do you adore? And as people start to do that unhooking process takes time, but it takes a long time to get it. You just can't wake up one morning and decide, I'm gonna unhook, and you're unhooked, But doing that in the company of others who are doing that. That's why our self-help groups are so important. Consciousness raising groups. You know that term. That's what we need so that people can come and figure out how other people did it, what you're thinking, and what's not good about your thinking.
Hello.
Hi.
I just had a thought, and I just wonder what you think about what entertainment, television, movies, the internet could do to further this cause.
Yeah, this is an interesting blessing. I was thinking about violence and the whole increase of violence, because I happened to live during a time when we didn't have television, and I can remember when television came in to our house like in the late 40s, early 50s, and my mother's best friend, Miss Florence Henry, said to my mother, the real popular show was Gunsmoke, and she said to my mother, Matt Dillon kills somebody every Saturday night. And sometimes I think about, and so last night I was thinking about that just before I went to sleep, and I wondered, can you count how many people get killed in a day on television now? And our whole culture needs to be rethought about what we elevate. And I'm so disheartened with every time we have one of these shootings, you get an escalation in gun sales. What is that about? What is our collective psyche doing? You know, so it's a real problem. And I think all of the social media, the television, that needs to be used to untrain us just away from that balance and retrain us to more of a non-violent kind of society. And my son drives truck for UPS, and he goes to this little town outside of Gainesville, and he delivers to this gun store. And he said, this guy is just really, you know, he seems like a really nice guy, but he is constantly asking Wesley, why don't you buy a gun? Why don't you buy a gun? Wesley said, I don't need a gun. Why don't you buy a gun? So Wesley said, I'll buy some sunshades, thinking that that will keep him from doing it. But there's so much in our society that promotes people owning guns. And I'm not saying owning them is bad. It's just when you use them to shoot people or when you use them to threaten people's lives, that's when it's bad. But I think Canada owns a lot of guns, but they don't kill up all the people in the world with them. They don't have all these, you know, what is in our heads? That's what I need y'all to research and find out what goes on in our heads that make us want to live in such a violent society. I don't get it.
Okay, oh, now everybody has questions. We'll take one more.
Hello, thank you, all of you, for showing up. I have just a couple things. I'm interested in in Gainesville, when you allowed the men to participate in the birthing process as well as the pregnancy with the women, the impact of that on the family, because I think sometimes we have a tendency to look at women's issues and we leave the men out.
Right.
And I think because it needs to, you said yourself, it needs to be looked at holistically. I think that includes the men as well. And I work as an advocate at RVAP here in town, which is the Rape Victim Advocacy Program, and I'm always surprised at how we don't really push the men to the side, but we need to. I believe we need to be way more aware of how we deal with the men, because if educating women were enough, rape would not be on the increase.
Right.
For instance, so I'd like to know about if you saw or did any research about the divorce rate with the men who were able to participate with the women birthing. And then just one other quick thing is when you do all of this, I really appreciated what you said about focusing on the positive. I feel like Donald Trump here, but when you said you welcome the sisters, I wondered if I was a sister. Or if you were including just the Black women, because I think there's enough separation between all of us. Mm-hmm. There's separation between whites and whites, blacks and blacks. So I'm a sister, regardless of my skin color. And my final thought is the neurobiology of the brain and trauma, and how that gets addressed in the studies, because that's incredibly important with who we become and how we react to stressors in our lives. And if that's being looked at, like for instance, in your latest initiative. Thank you.
Great, good questions. I'll see how many of them I can answer. I'll take the hot button one first. My welcoming the sisters was not to exclude other people, but it was to say, I'm glad to see you here, because you have no idea how many totally white audiences I have stood up and spoken to, because people did not go out to make sure that there were Black women there to hear me, and that I do consider it an honor, but it's not to exclude you. I think I spoke to everyone first, but I just wanted the Black women to know that I'm glad you're here and that you are paying special attention. And I'm glad you're here because I need you to be here too. So it's not exclusion of you, but inclusion of them. And certainly you are. And one of them, I'm not a researcher, so let me just say that. The question about, you asked a question about the men and their involvement. I'll tell you what the modeling is by giving you a personal family example. When my son and his wife got pregnant, I learned that he works for UPS, as I told you, he went on every single prenatal visit with her. And I kind of said to him, oh, you're going on visits with Angela. He said, well, Mom, that's what you said we should do. We should be involved. So I think the best way to teach is the modeling. And I think the best way is to say to the men, we want you here. You are not locked out. We expect you to be here. You helped make this baby, and we expect you to do that. We let them off the hook by saying you don't need to be here, blah, blah, blah. You can't take it. Well, they can take it. You know what I'm saying? So we just need to make sure they're included. And I didn't say this today, but everything I'm saying about women's health applies to men's health. And that we need men to be healthy too. You know, we are not here by ourselves, and the women have done all the things they can do by themselves. You know, we'd be doing it, you know, but it's the bringing of the two together in a uniting way. And so I think one of the best way to do it is modeling yourself around birth. And then you answered another question that I don't think I can answer. I can't remember it now.
It just had to do with trauma on the brain and development and life skills, how it impacts our ability to literally be skillful in our own lives.
Oh.
What happens at inception.
Yeah, you're a little out of my range right there. You're a little out of my range. I'm sorry.
I think we're over time and want to be respectful of people's time. And we really want to thank Byllye and our panelists, Hansens. This has been just a fabulous community event. We thank you for being here. So let's thank you. For interaction this afternoon at 4. And I used to tell my kids when they had a play date, if you leave wanting more, it was a good play date.